Dzień dobry, witam Państwa serdecznie. Kolejny odcinek programu Rzecz o Biznesie. Dziś pomówimy o zdrowiu, o prewencji, o profilaktyce, w szczególności w kontekście takich chorób jak rak, ale także o wydatkach w naszym kraju na ochronę zdrowia, właśnie na profilaktykę. A naszym gościem jest dzisiaj Cyril Schiever, Senior Vice President i President of Mid Europe Region representing MSD Company. Good morning.
Good morning.
Nice to have you here.
Thank you for having me.
Especially that in our country, I mean, of course, in Poland, World Immunization Week is coming. So, first of all, I would like to talk a little bit about cancer prevention as a key health priority for Europe. I understand generally that it's better to prevent than cure. So perhaps you can. What's your remarks on this?
No, absolutely. I mean, as you just said, cancer is a key priority for Europe. If you take a step back and think about it, cancer is set to become the leading cause of death in Europe within the next 10 years. Today it's still cardiovascular, but within the next 10 years, because of the demographics, cancer will be the leading cause of death. And in the course of a lifetime, 1 in 2 European citizens will face cancer. 1 in 2.
1 in 2.
So that is why cancer is such a high priority. And that is why a couple of years back, European states launched the European Union Beating Cancer Plan. And if you think about it, beating cancer is not just a slogan. We need to beat cancer and we can beat cancer. And it's going to be around multiple actions. It starts with lifestyle, because lifestyle is important.
Yeah.
Environment, pollution, prevention, and obviously treatment. And in the prevention, and you touched on immunization, you have all the aspect around primary prevention, around screening, but also around immunization, because some cancers, in particular the HPV-related cancers, are preventable through immunization. So this is why, I mean, this topic is so important.
So you mentioned about HPV. So how does Poland's plan for the elimination of this disease and HPV-related diseases align with broader European health priorities? Because I understand that you have...
I mean, the World Health Organization has set goals with the ambition of eliminating HPV-related cancers. And these have been adopted within the EU. And it's great to see that back in 2023, Poland launched an ambitious national immunization program as well as better screening program. So,
but if I may interrupt, our country was last in European Union, yes?
Poland was one of the last countries to really adopt such a broad program. But now we have it. So that's I think is very positive. It's going to be all about really getting a lot of education, because one of the challenges is that the awareness is low. So you need to raise awareness. And
but you mean awareness in our country or generally in European Union?
In European Union, we see heterogeneous level of awareness, but we see awareness now relatively high. And there Poland has an opportunity to really increase awareness. And we hope that with the intention to eventually have, starting after the summer, some healthcare education in school, we can also raise awareness generally on healthcare, on vaccination, and including on HPV vaccination. So that's one. The second is, historically, many people think that HPV-related cancers are really concerning women, but they also concern men, boys. So it's really important also to implement programs that address and raise the vaccination coverage rates for both women, but also for men. So this is a second really important priority. The third is you want to be able to have very high vaccination rate early on. So you want to vaccinate early, but you also want to vaccinate and catch up on the many millions of men and women who have not had the chance of being vaccinated. So those are the steps that a country like Poland needs to take, and that many countries have taken and are very successful.
So, what can we do to speed up our program? I mean, Poland's HPV program. I would like to ask you about what lessons can be learned from other European countries that have successfully implemented similar initiatives.
So, one thing we've learned is how important the voice of the policymakers is. So the first thing is we would need governmental leaders at the highest level to really embrace a broad and the importance of immunization, not only HPV, but HPV in particular. The second is the current program in Poland is very focused on the 9 to 14 years old.
Yes, exactly.
So first thing is we need to get that program to be successful, hence the importance of working within the schools to really raise the vaccines coverage. The second is we need to improve the program for the 15 to 19 years old. All those adolescents that are getting into their life, they deserve to be able to access vaccination as part of the national immunization program. So I think this would be an important step to take.
So now let's talk about a little bit about our second topic, if I may say so. I mean, financing healthcare and, of course, investing in health prevention. And my first question is, how have European countries structured their funding models for cancer prevention programs? And what lessons can Poland learn to improve its own investment in preventing healthcare? Because I understand that you have general outlook. You work in many countries, so
yeah, I have the chance of working across Europe, and it's a broad question. It's a broad question. I think what data shows very clearly is that investing in prevention is one of the best actions that one can take. Many different studies shows that for €1 spent in prevention, the return on investment, the benefit for society is the highest possible. So it's I would say an easy decision that there is absolutely no worries to have that when you invest in prevention, whether it's going to have an impact or not. On average, a country like Poland invests around 2% of their healthcare on prevention, and simply by doubling that from 2 to 4% and getting closer to the average, which is still quite low, unfortunately, in Europe, the impact would be tremendous. Because I'll give you a few examples of how important prevention is. If take breast cancer. Breast cancer diagnosed early, 9 out of 10 women have a chance to survive. Take HPV, which we were discussing. When we look at the group of 20 to 24-year-old women in the United States, and you look over 10 years, the reduction in cervical cancer has been 64%. So just having, a better investment in prevention, doing the screening early, having the immunization is having tremendous impact. So that's why, we really advocate for increasing prevention budgets. So,
and what's your opinion? How even how society can encourage, for example, our governments to give more money, simply saying, for this action? Because
at one point it's down to choices, and you may need to make those choices. And I recognize today those are difficult choices because our political leaders need to address, important also geopolitical challenges. So it's not easy to make those choices. What we're simply saying is a 2% increase, a doubling of the share that is allocated to immunization and prevention should be possible.
Because European average is 6%.
European average is at 6%, but we're at 2%. in Poland. If we would go already to 4, there's a lot that can be done. And then we can step up again in the coming years. We need to start somewhere.
Yeah, of course. Okay, so finally, I would like to talk a little bit about public-private partnership, of course, in area of R&D. And how do you perceive the role of pharmaceutical industry in enhancing the access to innovative therapies and the research and development?
So if we want to advance research and development and eventually have the highest impact on public health, you need to have all of the stakeholders that have a role to play to be around the table. Because as important as innovation is in medicines and vaccines, it's only one intervention in a very complex, healthcare system, starting from diagnosing, treating, etc., etc. So that's why we really advocate for collaboration, and we advocate for public-private partnership.
And do you think that this formula, public-private partnership, is the best?
It's one of the ways. It's one of the ways because, and I'll give you a couple of examples. Poland is one of the countries that is really increasingly leading on the front of research and development. It's the 5th country today in Europe, 5th or 6th in clinical development research. Our company, for example, has over 160 clinical trials running in Poland, with more than 500 research centers involved and more than 4,000 patients engaged in clinical trials. And I want to thank those patients. So now, how do you organize all this? Well, you need to have close partnerships with the academic hospitals. You need to have a partnership with the medical research agency, who's helping to structure the whole ecosystem. And one of the things that they're doing is the whole piece around data. And we can link this back to funding, because it's not only a question of funding. What governments can do better is know what works and what doesn't work. And the only way they can know what works and what doesn't work is if they have the data. And the data starts at the clinical research moment, but it also continues in real life. So that when a patient is being cared for, we can know which intervention worked and what didn't work. So that's why, for example, we have strong collaboration with the Warsaw Innovation Hub and with the Medical Research Agency, is to try and help advance those topics. That's really so critical.
So you mentioned these 2 examples. Can you elaborate a little bit more about it?
Well, I can elaborate on a recent example from 2 days ago, where we signed a partnership with the Medical Research Agency on medical education and how collectively working together we can help develop the future medical leaders. So we launched a partnership under the umbrella of what is called MedConnect. And it's going to be to have graduates of universities in Poland to be able to complement their studies with 1-year internships in companies such as ours, to be able to understand how decisions are on access for patients. So it's going to bring another dimension to the more academic education that they receive at university.
Okay, thank you very much for your remarks.
Thank you.
Our whole conversation. Let me remind that our guest today has been Cyril Schiever, Senior Vice President and also President for Mid-Europe region in MSD company. Thank you very much.
Thank you.